Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about oral psychosomatic disorders. Let's start. So today's episode is actually kind of close to my heart because one of the oral psychosomatic disorders actually is very close to me, which is oral lichen planus. There are a lot of oral psychosomatic disorders and diseases, which basically means that psycho and soma means psycho means your mental health or your mind, and soma means your body. Somewhere down the line, if you really think about it, your mental health really affects your overall health also, in terms of any sort of physical stress, in terms of any sort of mental stress, in terms of any sort of chemical imbalance, in terms of coping mechanisms which might not be very great or very harmful for your body. Now, when it comes to psychosomatic disorders, there's a plethora of evidence about a lot of emotional disturbances or episodes that might be causing you grave harm, mentally also help in causing you medical and dental and oral harm. So your emotional health and mental health can really affect your oral health in terms of dryness, in terms of burning sensation. You can get a lot. The classification is huge, but on the top of my head, what I remember from reading, and I've also gone through this myself, any sort of chronic stress in the form of mental stress can cause you various disease-like conditions such as oral lichen planus, mucous membrane pemphigoid, recurrent aphthous stomatitis, aphthous ulcers, burning mouth syndrome, any sort of dryness, xerostomia, candidiasis. Basically, every time you get mentally stressed out for a long period of time, there is some sort of neuronal, hormonal and a chemical imbalance in your body that tips the whole balance into something more destructive. The immune response gets suppressed. There is chemical inflammatory mediators that get released, such as tumor necrosis alpha, interleukin 1, interleukin 6. You have the release of cortisol that causes a lot of other problems, and it affects all your organs. On top of that, once you are stressed, you try to cope it with very bad deleterious habits such as smoking and alcohol and drugs and recreational activities. You cope with different things. You stop doing the things that you love. You sleep erratically. You take too much of caffeine so that you can get up because you sleep erratically, not able to sleep. Your mind is in a state of constant anxiety. Now, I completely understand because I've had lichen planus happen to me because of something that happened about 13 years back. Some familial emergency had happened and someone was in the hospital, and I was really tense for 10 days and I really developed that. So I know how your emotions and your mental health play an important role. Now, what is the message to you? Today, in today's day and age, mental health is very important. Oral health is also very important. And if you are getting any sort of symptoms which you cannot ascribe to any particular cause, if you have habits, that's a different thing. If you have medical problems such as gastritis or any sort of deficiencies, that's a different problem. But if you have nothing and you're getting some sort of lesions in the mouth, then you have to think it over, maybe to an angle of the fact that you are mentally stressed or disturbed. I'm not going to put a label to it because I'm not professionally qualified to make sure or diagnose whatever mental issues you might be having. But just in case, if you think that there is a slight possibility that you might be sleep deprived, or you're overworked, or you're burnt out, or you're not eating adequately, or you're smoking too much, you're drinking too much to compensate for something that is causing you stress, otherwise in a deep rooted fashion, I think you should start managing that stress first. Go for meditation, yoga, any sort of sports, gym, workout, running, anything that helps your cause. And if that also doesn't help, I would strongly recommend that you take professional help from psychiatrists or psychologists or counselors, and then take care of your mental health as well as your oral health by visiting your dentist very regularly. So that's it for today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly drop me a message with your name, your place, that is your location, and what is causing you discomfort. Please refrain from calling me directly as I might not be available. Just drop me a message and I'll get back to you within a couple of days. If at all you want to get some of your queries, apprehensions, doubts or insights put up, please put them in the YouTube comment section. So that's it for today. Thank you.